I really appreciate the invitation to share some of the work that we're kind of just finishing up doing. So yeah, this focused on kind of two aspects, delivering training to dairy producers for pain control for disbudding, which maybe sounds like a whole lot of nothing if you're not, dairy isn't something that you do day to day. But just a real brief background. For the most part, dairy calves are born with germinal tissue on their horn buds that grow into horns. This is changing with genetics, but isn't something that's going to rapidly change how calves have horns overnight. And so in the meantime, virtually all farms perform some amount of disbudding where they poll the animal when they're a very young age. So either through a chemical burn or a cautery burn, which prevents them from growing a horn to avoid having injuries to other animals or to the people that handle them. So really common procedure that we know is painful. We know how to provide best practices for pain control, but this research here is kind of focused around how we deliver that information to producers. And for the most part, this is coming through veterinarians, as well as understanding what the barriers are to adopting pain control for these procedures. So yeah, I want to acknowledge the team that I had to work with, the excellent team for this project. It included Dr. Cynthia Miltenberg with OMAFRA, Dr. Erin Nelson in the Department of Sociology and Anthropology at the University of Guelph, Dr. David Renaud in the Department of Population Medicine at the University of Guelph, and Dr. Jennifer Van Oss at the University of Wisconsin-Madison. And as well, the main contributor to this project was Julia Saracini, who this project made up the bulk of her MSc thesis. So this project was kind of came about through another KTT project, which my research group was involved with previously. And this was looking at different ways to deliver information to dairy farmers around how to best deliver pain control for disbudding. And so I guess maybe I should also introduce really briefly, you can see the kind of graphic on the first slide there. One of the kind of essential aspects of pain control for disbudding is the administration of local anesthetic. And this is a really inexpensive medication to use, but it does require training in order to give it in the right spot. So if anyone's ever had a cavity filled, it's the same idea where you're desensitizing a nerve. And it's really important that you get it in the right spot, because if you've ever had a cavity filled and they didn't quite get it in the right spot, you can feel it. And the same idea here. So this is kind of where that needle, long needle is in that picture there with the lidocaine. So the previous work that we've done has taken dairy farmers and trained them in different ways and then evaluated very quantitatively how effective the training was. So basically we looked at online training, hands-on training, and then a combination of both. And this is just a really brief summary of kind of what we've learned before. And that was in terms of actual efficacy. And here's a little video of maybe not the greatest technique in terms of holding the disbudding iron, but you can see that calf is not tranquilized or sedated. That calf doesn't feel at all that her horn bud is being burned. So that was a really successful application of the nerve block. And essentially what we found is it doesn't really matter too much how you train people. You can actually train people to do this technique really effectively just with online training. But this was done all very pre-COVID. This is maybe not a surprise now post-COVID that we're trying to teach students in an online setting. So yes, it was equally efficacious, but people did not feel that it was equally efficacious. So the confidence and the speed and even some of the technical skills were much poorer in the online only group. And we're definitely finding that in our vet school curriculum, that the students have the knowledge when we do online learning, but they don't have the confidence that comes with the hands-on application. So this project was focused on further refining how to deliver these training programs to dairy producers, as well as improving our understanding of barriers to adoption. And what I'm going to share with you today is mostly focused on the second part, because this project was developed pre-COVID, but implemented post-COVID, and having those group workshops with dairy farmers was just not possible in the last 18 months. And so we've really been focusing on this other aspect of understanding what barriers are out there to adoption. And another really brief part of kind of why does this matter, and kind of why does the answer to this question matter to the agriculture sector. So dairy farmers of Canada, which encompasses anyone who is commercially shipping cattle, like dairy cattle milk in Canada, is governed by a quality assurance program implemented by the DFC called ProAction. And this has an animal care component that has requirements around practices for disbudding specifically. But we know that even though these requirements are a mandatory part of the program, there is a difference between, following a quality assurance program and actually, changing day-to-day practices on individual farms. And so the goal with this program was certainly to give information to DFC and our provincial organizations too, to better help the implementation of these programs, but also in the mind of, I think veterinarians and animal welfare scientists is also to better understand what those barriers are, because changing practices on farm, I think, is much more effective when it's something that is desired and something that farmers are actually wanting to do, as opposed to something that they feel like they have to do because of assurance program is mandating that they follow this rule. And I think certainly for most people, we follow rules when we have to, but we really do things because we feel it's the right thing to do. And so that's what we kind of want to tease out is, what are the barriers there that are stopping people from maybe adopting some of these practices? So this is Julia, who completed the major amount of work on this project. So she did phone interviews with dairy producers from August 2020 to January of 2021. Initially, we recruited producers through advertisements, as well as snowball sampling by asking participants to recruit or advertise the information to other farmers that they know. So we got 29 participants, and I won't give you a whole bunch of demographic data, but it included, obviously majority of farmers that are multi-generational, but also some new entrant, people who are new entrants to shipping milk, but also people who are new to farming and that their connection to their farm is through their spouse. These interviews were analyzed using thematic analysis. And although we had kind of a convenient sample of participants, and actually we ended up going past data saturation on some prompts because we were surprised, but people actually really wanted to talk about this. And we wanted to make sure that everybody that wanted to have an interview with Julia was able to do that. So we did reach data saturation on most of the prompts. So I'll share what we learned here. So again, this is a really kind of brief overview, but we wanted to look at what are the motivators towards using pain control practices and what are some of the barriers. So the major themes that emerged from the motivation side centered around calf comfort and kind of recovery, how well do the calves do after the procedure, as well as general concern for the animal's welfare, as well as public perception. So I'll just share a couple of quotes that kind of speak to this. And again, these quotes don't, represent everyone that spoke to a certain theme, but they just kind of reflect the general theme here that we found. So this farmer said, I think most of us are just fairly concerned about the well-being of our livestock. So if we can do something that improves that or minimizes the negative impacts of practices that we have to carry out, I think that's a bigger motivator than any regulation. You wouldn't go to the dentist to have a tooth pulled without having it frozen. I wouldn't. It goes hand in hand with this budding. And then in terms of public perception, this quote said, I think consumers already have a negative enough vision of agriculture that we don't need to go out of our way to make ourselves look bad. We should be doing things collectively to say, hey, we're doing the best things we can do right now. So I think a lot of these stories are important. And I think in terms of where we're at on our research side, we've kind of just recently pulled this stuff all together. You can see it's kind of in review for a journal right now. But our audience for this certainly is fairly broad. For sure, I think this is information that is important to send to industry. I think this is on a motivation side, important, especially the idea again that regulations can cause compliance to some degree, but doing something that someone believes in is a much bigger motivator, as well as it's a good story in terms of people care about animals, they care about the animals on their farm, and they try to do what's right for them. In terms of barriers, our barriers that came through included cost, lack of training, farmer attitude, and age at disbudding. So just some examples here that speak to that. I haven't started freezing yet because I'm nervous of sticking that needle behind the eye. I haven't I'm not sure how many guys actually have, sat down and been shown by a vet or another farmer how to find the nerve, how to block it properly, and that sort of thing. So they just keep going with what they've always gone. And those ones definitely speak to, despite the fact that ProAction has evolved in terms of requirements on this particular area, there's still a lot of opportunities for training out there that are maybe going unnoticed. Age, certainly the perception that young animals, and I won't read all the rest of these quotes, but the perception that young animals don't experience pain in the same way as older animals. This is certainly a perception that's, it's been shown in other literature as well, but it's something that we found within our sample. But we also found this idea of farmer attitude, and that kind of came up a little bit. It came up only in the fact that our participants felt that they described themselves as being progressive, and they talked about a kind of divide between younger, more progressive farmers. And the second quote there says, "I don't know how to describe them. Like old dude farmers seem to resent what ProAction tells them and don't seem to see the advantage as much." We definitely didn't have anyone that self-identified as an old dude farmer, but a lot of our participants did feel that there was a bit of a divide in terms of how they felt about the quality assurance program. So again, I think this information is stuff we're going to be communicating back to veterinary groups as well as the industry itself too. And just a really brief note, we also were able to update our website a bit in terms of our online tutorial as opposed to actually conducting workshops. But yeah, thanks very much.